When CrossReach was founded in Victorian Scotland, the gap between rich and poor was huge. Social care, as we now know it, didn't exist, but one Church of Scotland visionary, the Reverend Professor Archibald Charges, saw the potential for a church-wide creation to reach out to the addicted and abandoned. The seeds sown then still inform much of the modern-day social care that the organisation still undertakes 150 years on. Viv Dickenson is their Chief Executive Officer, and she joins me now. Good morning, Viv. Give me a sense briefly of the areas that CrossReach covers.
CrossReach is a large organisation which works from early years to golden years, so working from the very early stages of life with women who have anxiety or depression during an antenatal or postnatal period, right through to working with people at the end of their life in a care home with dementia, potentially. We also work with addictions, homelessness, mental health, children in care, children with disabilities, learning disabilities, older adults and older people with or without dementia. CrossReach does cover a multitude of areas of work, and none of that is possible without the dedication and commitment and passion of our current staff group. I can't really stress enough how remarkable the social care workforce are, both now and I'm sure have been over 150 years. They are passionate and committed and very undervalued. I think care is an area which we need to recognise and value for its professionalism and skills, and this is a workforce which we should be paying tribute to at this time.
And of course the changes in social care are so different to what they were when the organisation was founded, as I said, 150 years ago. Your resources, of course, are limited. Does that mean that you have to make tough decisions or be inventive?
Well, both. I think it is incumbent on us to make sure that we are making the right decisions for the people who depend on us for the services. And sometimes we have to stop investing in a piece of work to be able to invest in a new one. We hope that where we do stop investing, that's because actually there is enough provision through either other providers or through the state. The inventiveness comes for new areas of need which potentially are emerging and which we would like to get involved in, but where there's not necessarily wide recognition of these issues right at the start, and that's where we're particularly inventive about working with partners to bring forward new solutions and to make sure that the net of care is spread as widely as possible.
So what is it that guides you? How do you decide on the focus?
Usually it's something that's suggested to us by people who are already using the services or who know about our services. And then we would be looking to see if we had the skills and expertise within the organisation to really be thinking about a solution, or whether we had a partner organisation that could work with us. We would be trying to decide whether it's an area that's within our particular mission or not. And after we've tested all of that, then we would potentially go forward with a pilot or phase 1 project to test that we had the right sort of support for people in whatever area of need is being brought forward to us.
As I said, there have been so many changes socially, and I think too that we all feel a bit more empowered to talk about things that wouldn't have been discussed 100 years ago, maybe even not even 50, 40 years ago. In particular, concerning one of the projects that you've pioneered, and that's the Bluebell project, a postnatal depression service. Strangely, that nothing really existed as such. Why do you think this wasn't prioritised before by other organisations?
When I first started working with postnatal depression, I very quickly became aware that it was actually something that people felt very stigmatised by. It was difficult for women themselves to talk about transition into childbirth, and particularly where they weren't feeling good about that, either good about themselves or good about being a parent. And breaking down that sort of stigma, allowing people to come forward not feeling bad about that and saying, well, actually, there are many, many people that feel feel this way, and we can only start working with an area when people come forward and start talking honestly about their thoughts and feelings and normalise something. It's not easy being a parent, and we should be allowing much more openness in society to talk about mental health difficulties wherever they occur.
And you've been visionary in the fact that you've recently extended to include dads.
Yes.
Within this part of the project or the service that you provide.
Yes, and that's a very good example of where we would invest in a piece of work. So through working with mothers and their children, we very quickly became aware that there were many fathers who were also saying actually transition into parenthood is as difficult for us, and yet the service provision is even worse than it was for women. So we opened up the service quite early on to being able to include partners, particularly fathers, in either accessing counselling or family support.
And of course, CrossReach is a faith-based organisation. Is that sometimes a hindrance as much as it can be a help?
It certainly invites a lot of curiosity, I think, at times. So there is sometimes an initial reaction to us being a faith-based organisation, particularly as we are very closely working right within the heart of the Church of Scotland. And people sometimes come with their own preconception about what that would look like. I think where it helps is that we have a very clear value base, that we have a very clear way of working with people, which is about respect and dignity and value. And I think once people get past their original preconceptions of potentially what a faith-based organisation is like, they realise that actually the value system that underpins that is a value system which is valuable across the whole of society and which is recognised, and that allows us to do our work very widely.
I suppose in a sense, looking at the fact that you predate the NHS, it's extraordinary in some ways that you're still around, but does that indicate something of a failing in society, or do you also see it as perhaps a reminder to each and every one of us of the importance of caring for one another, and without this we would leave all the caring to formal organisations?
CrossReach is a professional arm of the Church of Scotland's care, but actually I think it's a continuum. I think what you get is a lot of excellent work that's done in local church congregations, which is that reminder, that getting alongside people in their communities, that imperative of the gospel to care, to demonstrate something of love in action. The church has had that professional organisation which has backed up what is done locally in communities, and it is potentially that reminder to the church that there is always a social need.
Of course, poverty is still with us. Different kinds of poverty. It's at the root of so many physical and emotional health problems in Scotland. Tell me, or let's talk about some of the other projects that you're involved with, and those that particularly try to help people out of the cycles that trap them.
One of the, I think, pieces of work which is a really good example of that would be the work that we do in addictions. We have a number of addiction centres which are residential rehabilitation centres. When people manage to complete that programme, we're then able to take them on into supported tenancies and help them to rebuild lives that are free of drugs and alcohol, but actually are much more connected with community than being in a residential rehabilitation centre. Many people who have completed that programme then go on into something called a Recovery Volunteers programme, and that's about peer mentoring. So people who've been successful in recovery often want to give something back, and we equip and train people who have been through recovery to become peer mentors to others at the beginning of that journey, to hold the light for them, and then to come on into employment with us. And that helps to break a cycle, to give people a hope and a future, and to give them real different options and opportunities for their lives.
The Reverend Professor Archibald Chartres mentioned him earlier, the founder of CrossReach. What do you think he would say today if he knew that Glasgow still has alarmingly low rates of life expectancy compared to the rest of the UK?
I'm sure he would be incredibly disappointed that some of the social difficulties that were being picked up in Victorian times are still with us, and that perhaps progress hasn't been made in a way that it could have been made. over the years. However, he probably would have been amazed at some of the services that are now picked up by the state and are commonplace for people, that there is much wider access. So there would probably be a mixture of both disappointment but also incredulity in how much the world has changed over that 150 years and how much the state is now doing, which is remarkable.
Thanks very much indeed, Viv. That was Viv Dickenson, Chief Executive Officer of CrossReach.